Hi, welcome to today's webinar on how to simplify Medicare and make an educated decision on your Medicare coverage without all of the headaches and confusion. I'm your presenter, Jesse Grutz. I am shooting today's webinar in our office located in downtown Delafield, Wisconsin. Before we get into the great information I know you're waiting for, I would like to let you know that we invite your questions as we go through today's class. Just submit your question on the right side of the screen and I will try and get to it. We're going to get right into the first few slides and get started. Thank you again for attending. So I'll be teaching you this by showing you the facts that you absolutely should know about Medicare. This is a key points you need to know webinar that we developed to change those with or going on to Medicare make their decision on what coverage to get. To simplify Medicare and get the coverage you need, it doesn't take guessing or hoping when you listen and follow along with the information I'm going to show you today. So who is this webinar for? It's for anyone turning 65, retirees losing group coverage, anyone currently on Medicare but not sure if you have the right coverage. Again, my name is Jesse Grutz. I'm known as the top educator on Medicare for retirees. I'm the creator of the educational approach that assists clients in having confidence in choosing their Medicare coverage. I have over 10 years of Medicare experience. I started what is now Grutz Financial LLC over a decade ago that also serves my clients as an investment advisor representative. I have a fiduciary duty to put my clients' interests first. I am currently the vice president of the Delafield Lions Club and serve on several City of Delafield planning committees. And if that doesn't keep me busy, I am married with 4 daughters, and they absolutely do keep me busy when I'm not here at the office. So in the next 60 minutes, here's what you'll learn. You'll learn how to simplify Medicare so that you can end the confusion and stop worrying about how you're going to get through the process. You'll also learn how to clarify the differences in the various insurance options and if you can switch plans so that you get the best coverage that fits you. Is this webinar for you? If you're tired of all those solicitations coming in the mail that aren't really helping you learn anything, then this is for you. Or if you've gone to other seminars or educational classes or live webinars and left feeling just as confused or even more confused than before, then this is for you. Or if you're simply feeling overwhelmed and not sure where to turn to next, then this is for you. Just a few house rules for this webinar. This is not a sales pitch for any one company or product. No frills, just facts. I will warn you, we are going to cover a lot of information today, and I'll try to keep it as interesting as possible, but again, there's a lot of stuff to cover. So if you're serious about Medicare coverage and making a great decision, then I can help you, and I'm glad you're here. Now make sure to stick around to the end to get all of the information. At this point, folks, we're going to get right into the information. If you have a pad of paper and pen available, you might want to be taking some notes. So without any further delay, let's get into it. When we first start with Medicare, there's 4 parts. You have Part A, B, C, and D. Part A is hospital insurance. Part B is medical insurance. These 2 combined together are known as Original Medicare. Part C is also known as Medicare Advantage plans. These plans are optional, and we are going to talk more about those later today. And Part D covers prescription drugs. Looking at Part A costs you $0 a month, and there's a couple benefits under Part A. The first one that we'll cover here is hospital inpatient benefits. The key here to understand is you must be admitted as an inpatient to the hospital. If for whatever reason you're held under observation, Medicare does not cover your room and board. So as long as you're admitted as an inpatient overnight, again, Medicare will cover you. Medicare Part A has a deductible. It's $1,364 this year. This is a portion, the first $1,364 of room and board charges Medicare does not cover, so this is your responsibility. Once that's paid, Medicare will cover you 100% for the next 60 days. So that's the benefit period, is the 60 days. What you have to understand here is that if you're If you're hospitalized for a 2 or 3 night stay and then you come home, if you're rehospitalized, 2 weeks later, whether it's for the same thing or something different, you're covered 100% for that next visit. However, if you spend 2 or 3 nights at the hospital and then you come home and then 92 days later you're back in the hospital, that would trigger another A deductible of $1,364. And the reason for that is more than 60 days had passed. It had been 92. So be careful there. This is a deductible that you could see multiple times throughout the course of a year. Now, if you were hospitalized 60 consecutive days, as we just talked about, Medicare is covering you 100%. However, on that 61st day, Medicare says that they're going to cover all but $341 per day, and again, that's days 61 through 90. Should you be hospitalized 91 consecutive days, on the 91st day, Medicare says they're going to cover everything but $682 a day, and that's days 91 through 150. Are there any questions there on how that deductible works? If so, just submit it on the comment section on the right-hand side, and I will try and get to that. The next benefit under Part A is called skilled nursing care benefits. Don't confuse this with custodial care. Medicare does not cover you in a nursing home. In order to qualify for the skilled benefit, Medicare does have a couple requirements. You do have to spend at least 3 days in the hospital, and then you must enter a skilled facility within 30 days. As long as you meet those two requirements, Medicare will cover you 100% for the first 20 days. Days 21 through 100, Medicare covers everything but $170.50 per day. Beyond 100 days, Medicare doesn't pay anything for skilled nursing care. So this is a very short-term benefit. A couple additional benefits under Part A. There is a blood benefit, there's an inpatient psychiatric care benefit, and also a hospice benefit. Now, for most of you out there, the majority of your claims, once you go onto Medicare, are going to fall under Part B, which we'll talk about next. Again, Part B is your medical insurance. So this is, first thing to understand here is the standard premium for 2019 is $135.50 a month. Now, the word standard is used here because this premium is something that is means tested. So what Medicare is doing is they look at your income 2 years in the rears. So for your 2019 premium this year, Medicare is looking at your adjusted gross income for 2017. And then that's readjusted every year. So for next year, they'll be looking at your 2018 adjusted gross income. Here's the two thresholds. If you file a single tax return, the income threshold is $85,000, and again, that would be for 2017. As long as you're under $85,000 as a single taxpayer, or if you file your taxes as a single individual, you'll pay the standard premium of $135.50. For a joint filing, if you're married filing jointly, that income level is doubled, $170,000. So as long as you're under $170,000 for 2017, then you'll pay the standard premium. Now, for any of you out there that exceed these income limits, you do receive a letter in the mail from Medicare that's identifying what that income level is, and then again, that is adjusted every year. They're always looking 2 years in the rears. So as far as Part B, again, this is medical insurance. What does Part B cover? Part B covers things like inpatient, outpatient doctor services, surgical services and supplies, speech and physical therapy, diagnostic tests. These are your MRIs, EKGs, CAT scans, X-rays, durable medical equipment, ambulance services, home health care, and some preventive care. For those of you that have this, or you can go online to Wisconsin OCI, the Office of the Commissioner of Insurance, you may want to download the Buyer's Guide. It's the guidebook to those on Medicare here in Wisconsin. You can download it. If you want to request one, I can have one sent to you as well. In that book on page 7, the Commissioner of Insurance addresses preventive health care. The statement that he makes is Medicare helps cover some preventive care services. So for a full listing of what Medicare currently covers for preventive procedures, you can go to medicare.gov. The key thing to understand here is Medicare doesn't cover all preventive care. Part B has a deductible, so before Medicare Part B pays anything, the calendar year deductible this year is $185. So this has to be paid once per calendar year, and once that's paid, then Medicare is going to cover 80% of your eligible covered charges. So that's anything that we just talked about on the previous page. Lab work is covered at 100% once the deductible is met. And be careful on the preventive services. Of the benefits that Medicare does cover, also understand that the amount they cover varies upon the procedure. Some procedures are covered at 100%, while others may only be covered at 80%. Medicare supplements generally will pay that last 20%. So if Medicare Part B pays the first 80%, generally your supplement's going to pay the next 20%. We are going to talk about coverages for supplements, so although that may not be the case depending on what kind of coverage you exactly take out. But generally, your supplement's going to pay that last 20%. However, you may be responsible for something called excess charges. So excess charges deal with something called assignment. So in that guidebook from the commissioner, in the back of that book, there is a glossary of terms, and in that glossary you can find the word assignment. The word assignment means that as long as a doctor accepts assignment, they accept the amount that Medicare approved. If the doctor does not accept assignment, he or she will charge 15% above the amount that Medicare approved. So if Medicare approved $1,000 for a certain procedure, if the doctor accepts assignment, that means only the $1,000 is due. Okay, so then Part B would pay 80%, they'd pay $800, and then you would pay the last 20%. If the doctor does not accept assignment, they would charge 15% in addition to. So it's 15% of the amount Medicare approved, so 15% of the $1,000 is an additional $150 that Medicare will charge in addition, and they do not cover that. That would be your responsibility. So I can tell you today that there's several things that Medicare does not cover. Again, we mentioned it earlier. Medicare does not cover nursing care, nor eyeglasses and hearing aids. Botox, facelifts, tummy tucks. Medicare doesn't cover cosmetic procedures. Dental work and dentures, routine foot care. For a lot of you out there, be careful of this one. Medicare does not cover you outside of the United States and its territories. And then we mentioned it before, Medicare covers some preventive care, meaning that there's other preventive procedures out there that is not covered by Medicare. So if I were you folks out there, one of the things that I would be doing is when going onto Medicare is getting a good understanding of the financials behind Medicare. In other words, where is it most likely that Medicare will not pay? I guess in other words, when Medicare covers something, where are you most likely to have to pay out of your own pocket? I refer to these as the most frequent cost risks associated with Part A and B without a supplement. I think once you understand the financial risks associated with Medicare, that's going to help you decide what kind of supplemental coverage you want to go with to help cover the things that Medicare doesn't cover. So these are some things that we just talked about, but I've just put them all in one place here for you. So under Part A, Medicare has that, remember, hospitalization Part A deductible. It's the first $1,364 for room and board. Remember, this is only good for 60 days, so you could see this multiple times throughout the course of a year. And then you have that skilled nursing care benefit, days 21 through 100. Medicare is going to cover everything but $170.50 per day. And then you have up to 5% of the cost of hospice as well. Under Part B, you have that B calendar year deductible of $185, and then the last 20% of the total Medicare approved amount. Don't forget about those excess charges that we just talked about, could be an additional 15%. And then again, some of the preventive care. So how do you get enrolled in Medicare A and B? Well, it kind of depends on your specific situation. If you're receiving Social Security benefits already and you're turning 65, you will automatically be enrolled in Medicare Part A and B. Now, you're eligible to begin your A and B benefits on the first day of the month in which you turn 65. Now, there's always an exception to a rule. The exception to this rule is if your birthday falls on the first day of a month, so if your birthday is September 1st, you're actually allowed to start your Medicare benefits a month earlier. That would be August 1st. But if your birthday falls on any other day of the month other than the first day of the month, you will be eligible to start benefits on the first day of that same month. So the thing to understand here is, if this is your situation, Medicare actually mails you out your Medicare card automatically. Now, I have seen people throw these away on accident. Why? Because they're not expecting it. You're getting all these solicitations in the mail from the insurance carriers and postcards from insurance agents, and all of a sudden, here comes your Medicare card, and oops, maybe you throw it away. So let me give you a little tip here. When can you expect to receive your Medicare card in the mail? Over the last 10 years, folks, it's almost always been, almost to the day, 3.5 months before you're eligible to begin benefits. So if you're eligible to begin benefits on September 1st, you could expect to receive that on around May 15th. Okay, and again, it's almost to the day. Now, not always. It kind of depends how Medicare, if they're busier during a time of year for processing enrollments and things like that. But again, about 3.5 months to the day. Now, here's where you have to be careful. If you're not receiving Social Security benefits, you're not automatically enrolled. Okay, so I know some of you out there are delaying Social Security benefits beyond age 65, maybe to your full retirement age of 66 or 66 and 2 months, let's say. And here's where you have to take action. You actually have to enroll. You have to go to either ssa.gov or go to your local Social Security office. Okay, so ssa.gov or call your local Social Security office and set up a meeting to enroll in your Medicare A and B. Now, a question I get a lot is that couple or individual that's still working, what do you do there? And I always default to this answer. You got to check with the employer. Check with the HR department at your employer and ask, do I need Medicare Part B benefits when I turn 65? You're going to want to know this for a couple different reasons. Number one, getting enrolled. If you need it, you have to get enrolled. Number two, as we talked about, Part B comes at a cost, right? You pay $135.50 a month. If you're going to have to pay that, you're going to want to know. Okay, so go to the HR department and find out, do you need A and B benefits when you start when you turn 65? And then, if you have any questions, I can handle those on a one-on-one basis, but I would always default to that. So now that we've talked about Part A and Part B, it's only natural that we now move into our first type of insurance option, which is called a Medicare supplement. It's also known as a Medigap plan. And the reason why we go here first is if you were to buy a Medicare supplement, this is an insurance policy that's offered by private carriers that would sit in second position. So this would be part of a two-payer health care plan where you would have Medicare A and B as your primary. They're in first position. And then the supplement is in second position. Now, some things that you should understand about Medicare supplements. These are governed at the state level. So the Commissioner of Insurance here in Wisconsin, over in Madison, oversees the sale and coverage for all supplemental policies sold here in the state. This type of coverage is guaranteed renewable for life. This means that the coverage can never be canceled. Now, you do have to pay your premium every month, but as long as you pay your premium every month, the insurance company can never cancel your coverage. The insurance company can also they can never change your coverage. Now, I'll say that, but then there's a little caveat. Your coverage will never be any worse than it was the day you first bought it. It can actually get better. So if you have a rider, it's called, on your policy that covers that A deductible, if the deductible for Medicare goes up, then the coverage actually will automatically upgrade itself to cover that deductible for the next year. So you don't have to do anything. It automatically increases to cover the new deductible amount for Medicare. These policies cannot negotiate the reimbursement rates that get paid back to Medicare. They must pay that 20% balance after Medicare approves of the amount. Where can you go with supplements? Well, there are no networks. The only thing you have to be concerned with here is that the doctor takes Medicare. So as long as the doctor takes Medicare, they have to take any Medicare supplement sold here in Wisconsin. So this means that you can go anywhere in the United States as long as the doctor takes Medicare. There are no HMOs or PPOs that you would have to concern yourself with. You also do not have to declare a primary physician, and you do not need a referral to see a specialist. These types of policies do have to file their rate adjustments with the Commissioner of Insurance every year as well. So those are some good basics on supplements. Again, that's part of a two-payer system. So looking at supplemental coverage. Supplemental coverage here in Wisconsin consists of what's called a base policy. So any policy you end up buying for yourself, should you go with a supplement, is going to start with what's called a base policy. Now, this base policy is mandated by the Commissioner of Insurance, and what that means is this base policy is exactly the same for every insurance company that wants to offer a supplement here in Wisconsin. Now, there's only one area in this base policy that can be changed by the insurance companies. It happens to be on the very last page, the very last line of the base policy, and it's a benefit called preventive health care benefit, not covered by Medicare. You notice we're talking quite a bit about preventive health care here today. Wisconsin identifies in the guidebook, like I mentioned before, that Medicare doesn't cover all of your preventive procedures. They also address this in the base policy here in Wisconsin by requiring insurance companies to pay for preventive health care when Medicare doesn't cover it. The annual minimum amount, you might want to write this down, the annual minimum amount that's required in all policies is $120 a year. Now, this is $120 that insurance companies have to pay towards preventive health care that Medicare doesn't cover. The problem here is $120 doesn't go very far for things like annual physicals, colonoscopies, eye exams, hearing exams, vaccinations, things like that. So the insurance commissioner allows insurance companies to increase that annual benefit if they want to. Again, they're not required. They're required to pay $120 a year. And again, if they want to increase that benefit, if the insurance companies want to increase that benefit, they certainly can. So as you look at options, you'll see that companies pay that minimum amount of $120. Some might pay more, like $300 or $500 a year. Here's a little tip for you. There's 2 or 3 carriers here in Wisconsin that pay 100% preventive health care. This is the first area where you're going to see differences amongst these policies out there, at least through the insurance companies. So to build a Medicare supplement in Wisconsin, again, you start with this thing called a base policy. And then you may decide to add these things called riders to that base policy, and these riders will make the coverage be and do what you want it to be, okay? Now, we're not going to get into specifics on the names of these riders. What I think it's important to understand is how these coverages would end up working for you depending on what option you might go with. So the first coverage option is sometimes referred to as a comprehensive plan. Now again, you start with the base policy and you'd add some riders, but if you added the correct riders, This base policy would be a type of policy, or the comprehensive policy is one where as long as Medicare approves of your procedure, you don't pay anything out of pocket. That means there's no copays, no deductibles. In other words, it's a full coverage plan. Now, a lot of you out there probably talk to friends or family members that say they have a policy that, when they go to the doctor, they don't pay anything out of pocket. And that would be a comprehensive policy. So yes, you can get something like that out there. This might give you peace of mind knowing that everything's covered, or it might help you budget knowing that you just have to pay this premium every month. Maybe if you have some health concerns and there's some things coming up that you don't want to have to pay out of pocket, this might be a good type of policy for you. The next supplemental coverage option here in Wisconsin is called a copay Medicare supplement. The couple things that you're responsible for here, instead of having a full coverage plan, are some copays. So the way the copays work this year, you pay no more than a $20 office copay. You could actually end up paying less than $20, but we don't need to go in the math behind that. And then you would pay no more than a $50 ER copay. The only other thing you're responsible for besides those two copays would be the Part B deductible. And that, again, is a $185 calendar year deductible that Medicare does not cover. On this copay plan, you would be subject to that if you acquired any sort of health care benefits under Part B for the year. Other than that, you'd have coverage for the A deductible for hospitalization and the final 20% of a claim, obviously minus those copays that I just mentioned. We'll cover the next two here together. It's the 25 and the 50% coinsurance plans. The 50% one we'll start with first. Basically, on a 50% coinsurance Medicare supplement, wherever Medicare doesn't pay, you're paying half of it, and then your supplement covers the other half. So an easy example would be if you had a Part B claim and it was $1,000, that's the amount that Medicare approved, let's say. Medicare would Part B pays 80% of that, so they would pay $800. That means there's a $200 balance. If you had a 50% coinsurance supplement, you would pay half of the $200. You'd pay $100, and your supplement would pay the other $100. That $100 goes towards this year's max out-of-pocket amount, which is $55.60, as you can see there. And then you continue to pay 50% or half of what Medicare doesn't cover, and your supplement pays the other half. The deductible plan. The deductible plan is a little bit different. Instead of paying 50%, you're paying 100% of what Medicare doesn't pay. That means you'd pay the A deductible, you'd pay the B deductible, you'd pay the last 20% of a claim. And any and every dollar that you would pay out of your pocket goes towards the annual maximum of $2,300. So that's your max out of pocket per year, $2,300 this year. If you met that, then your supplement covers you 100% for the rest of the calendar year. Your last coverage option here in Wisconsin is called Innovative. The Innovative plan has a couple moving parts to it, so I'll explain it twice. The Innovative plan starts out as the deductible plan that we just mentioned. So you would have a $2,300 max out of pocket for the year. And again, if you hit the $2,300, you're covered 100%. Here's what's different about this plan. You would have that out-of-pocket maximum for 4 years. So after the 4th year, guess what happens? The deductible automatically goes away, and you automatically turn into that first coverage option, comprehensive. So again, for the first 4 years, it acts like the deductible plan. After 4 years, it automatically goes to the comprehensive plan where you have no out-of-pocket maximum. You have the full coverage. The key here is you keep paying the innovative price. So even though you have comprehensive coverage at the end of the 4th year, you keep paying the lower innovative price. What does this mean? Well, this means that you get to have comprehensive coverage for the rest of your life at a lower price than if you would have bought the comprehensive policy day one. So understand that these are all standardized, folks. A comprehensive is a comprehensive is a comprehensive. The only area that will be changed in any one of these coverage options is how much preventive health care does the insurance company offer. Now, don't make the mistake of thinking that, a flyer that you might have got in the mail today, that company offers all of these options. There actually isn't a company here in Wisconsin that offers all of these options. In a lot of cases, insurance companies are going to offer one, two, maybe three of these options. So you might have to, do a little bit of homework to find a certain coverage option that you might be interested in. So that kind of covers supplemental coverage options here in Wisconsin. But before we move on to our next thing, we do have to talk about one other thing in regards to supplements, and that is in reference to premium structures. This is also referenced in your guidebook from the commissioner should you choose to download that on the OCI's website. So what we're getting into here, folks, is if you decide that you're going to go with a Medicare supplement, supplements sold here in Wisconsin have what's called a premium structure that's tied to that contract. These premium structures can determine how your premiums initially priced to begin with, or what may influence a future price increase. So this is some really good stuff here. The first type of premium structure is called community rated or no age rated. This means that the same monthly premium is charged to everyone who buys the supplement regardless of age. All this is really telling us if you were 65 or 71, buying the same coverage from the same company on the day of purchase, both the 65-year-old and the 71-year-old, they would just pay the same price. That's what that's telling us. The next premium structure is called attained age, and here's what it says. It says, in addition to medical inflation and increased Medicare deductibles and copayments, your premium will also increase as you age. Now that doesn't catch many of us off guard, and this is due to the fact that you tend to use more medical services as you age. What it does go on to say then, premiums may be less expensive than issue age policies at first, but can eventually become the most expensive. Well, let's learn about issue age. Issue age says your premium will increase due to medical inflation and increased Medicare deductibles and copayments. However, it will not increase due to your age. Your initial premium will be higher than under the attained age approach because a portion of the initial premium is used to pre-fund the increased claims cost in later years. So, folks, there's no really right or wrong answer here. It's just understanding how they work and then making sure that you as an individual get the best premium structure that fits you. That pretty much covers supplements. We are going to get into Part C, Medicare Advantage plans next. So first of all, what will it cost you for a Medicare Advantage plan should you decide to go with one of these instead of a supplement? Well, you still pay the $135.50 per month plus any additional premium. That $135.50 is the cost for Part B. Now, the next thing you have to understand about Medicare Advantage plans is these are offered by private insurance companies. And if you were to buy one, the Advantage plan or the Part C would replace original Medicare A and B as the claims payer. So instead of being a two-payer system like the supplement where you had A and B in first position and the supplement in second position, Part C again replaces Medicare A and B. This is a single payer plan instead of a dual payer plan. This looks a lot more like your group insurance at work in the sense that it's just one insurance company or one payer. Now, what's actually happening here, folks, is the insurance company offering the Advantage plan, they start negotiations with Medicare. And Medicare and the insurance company, should they reach an agreement or a contract, inside that contract, Medicare agrees to send a subsidy to the insurance company every month for each person that's enrolled into the plan. So instead of paying your claim when you go to the doctor, like if you have original Medicare with a supplement, instead of paying your claim, Medicare just automatically sends the subsidy to the insurance carrier every month, regardless of your claims for that month. The insurance company takes that subsidy in, and then when you pay that $135.50 for Part B, because you still pay that, you're indirectly getting those Part B benefits still. Instead of getting them through the private insurance company, instead of getting the Part B benefits through Medicare, you're getting them through the private insurance company. So you do still have to pay the $135 Part B premium. Medicare does turn around and give that premium to the insurance company as well. So because of this contract between the insurance company and Medicare, this does tell us that these policies are governed at the federal level, not the state level. And because these Advantage plans are on an annual year contract, this means that your policy is not guaranteed renewable for life. That means that your coverage can cancel you. If terms are not met and there's no agreement for the following year, you would lose coverage and you'd have to go find something else. So just understand that. And if your coverage was not canceled, also understand that even though it may not be canceled, your coverage can change. So copays, deductibles, networks can change from year to year. These types of policies can negotiate the reimbursement amounts with Medicare. Now, instead of being able to go anywhere you want, like you can with the supplements, understand that there are networks. There's either HMO or PPO networks, depending on what type of plan you might go with here. Now, these PPO networks out there, they may be a nationwide network. That doesn't mean you can go anywhere. That just means that there are doctors throughout the country that are in network. Okay? They do not have to file their rate adjustments with the commissioner. Okay, they can charge whatever they want from year to year. The commissioner doesn't regulate rate increases. Now, what may be nice to these Advantage plans is they may include prescription drug coverage. So if you see a plan out there that automatically includes a Part D plan, this should be a little bit easier for you now to identify that that's an Advantage plan. Okay, any plan that automatically includes prescription coverage, that is a Part C Medicare Advantage plan. And for some of you out there, that might be kind of nice that you can wrap the prescription drug coverage and the health insurance all together in one plan. I would caution you on a plan like an Advantage plan that marries itself to a Part D plan. And the reason why is there's about 25 Part D plans available throughout the state, depending on where you live. And if you choose an Advantage plan that has a Part D plan automatically tied to it, just be careful there, because you really haven't considered then the other 25 or 24 or so other plans in your area for prescriptions. And what this could mean is when it comes to prescription coverage, you're really just trying to minimize your costs for your prescriptions. And if you haven't considered all of the plans, because maybe you've gone again with an Advantage plan that's automatically married you to a Part D plan, you really haven't taken the opportunity to minimize your costs on prescriptions by looking at the other 24 plans. So just be careful there. These Part C plans may also include some additional benefits like a vision or a dental reimbursement. So that might be nice for some of you to get a little kickback on some vision for glasses or some dental work like cleanings and things like that. As far as ratings or premium structures, these Advantage plans are all community rated, which means no matter your age, everybody pays the same price for the plan in their area. So hopefully that simplifies things in the Advantage plan space. Again, this is a single payer plan. It looks a lot more like your group insurance at work versus the supplemental plan that has the dual payer, Medicare first and the supplement second. Just understand some of these things here that we talked about so that you are making an educated decision. As we move forward here, we're going to talk about Part D prescription drug plans. So these are insurance policies offered by private insurance companies that are under contract with Medicare. So Medicare is sending the insurance companies subsidies. They are community rated, so everybody pays the same price regardless of age. And when it comes to prescription coverage, folks, when you leave the group insurance in regards to prescription coverage when on Medicare, you have to carry what's called credible prescription coverage. And if you don't carry credible prescription coverage and want to go buy one of these Part D plans in the future, you could end up paying a penalty. So I'll give you that window here in a little bit on when you need to enroll by. But again, understand you have to carry credible coverage. Otherwise, when buying a Part D plan, you could end up paying a penalty. So what is credible coverage? Well, credible coverage is buying a Part D plan. So if you buy a Part D plan, that is credible coverage. There are two other options here in Wisconsin. If you're a veteran and you qualify for VA benefits, the VA benefits include prescription coverage. that is considered credible. So you could use the VA benefits in lieu of a Part D plan and not be penalized in the future. As a Wisconsin resident, if you're 65 years of age or older, there is a prescription option through the state called senior care. Do not confuse this with Badger care. It is called senior care. You do have to live here in the state, and you have to, again, be 65 years of age or older at a cost of $30 for the year. So $30 for the year, you can enroll. Now, any income level qualifies to enroll into senior care. However, dependent upon your income level will determine what benefit you actually end up receiving. So the lower income households do benefit very well from senior care. And even if you are a little higher income household, you can still benefit from senior care, especially if you're on no prescriptions at all or very few inexpensive prescriptions. Because senior care is considered credible insurance, you could use it as a waiting room until maybe you need a Part D plan in the future. So it does meet Medicare's guidelines for being credible coverage, and at a cost of only $30 a year, it's a great way for you to minimize, again, having this credible coverage versus going and buying a Part D plan. Now, if you're on a bunch of prescriptions, a few brand name ones, and your monthly drug costs are $500-$600 a month, it's likely you're going to benefit more from having a Part D plan, but it does depend upon your household income as well. Now, once we start looking closer at these Part D plans, understand that there's some coverage stages. So the first stage is called the deductible stage. This is when you're paying full price for your drugs until you meet a deductible. Deductibles this year's range from $0 to $415. Once you meet that deductible, then you're in your initial coverage period. And this is when you're paying copay. So whatever prescription you're on, it might be filling, you're paying the applicable copay during this initial coverage period. Now, I'm sure some of you out there, or if not a lot of you, have heard of something called the donut hole. Well, what is the donut hole? Well, here's what's happening. While on the deductible and initial coverage period and you're filling prescriptions, the pharmacy is tallying, along with Medicare, what the full cost of those prescriptions would have been. So even though you're paying a $20 or $40 copay for a brand name drug, let's say, the pharmacy is tallying what the full cost would have been. And this year, when that tally of the full cost hits $3,820, you're now in the donut hole. So even though you maybe spent $1,000 out of your own pocket, if the full cost hits $3,820, you're now in the donut hole. So what happens in the donut hole? Well, this year, you get a 75% discount on brand name drugs, which means you're paying 25% of the brand name price. Generics, you're getting a 63% discount, so that means you're paying 37% of the generic price. Now, how do you get out of the donut hole? Well, a different accounting figure is used. Instead of using what the full cost would have been, now Medicare and the pharmacy is tracking a figure called TROOP, also known as true out of pocket. So now Medicare is looking at what you actually paid out of your own pocket. If you were to hit $5,100 out of pocket, out of your own pocket, you're now out of the donut hole and you go back onto coverage. Okay, that's how that works. Now, this is pretty confusing stuff. What I would encourage you to do is, if you're considering a Part D plan, first of all, don't pick a flyer out of the mail to base your decision on what Part D plan is best for you. The only tool you should be using is Medicare.gov. Medicare has a great tool on their website. Again, that's Medicare.gov. There's a great tool on that website where you can put in your zip code. You can pick up to 2 of your favorite pharmacies. And then you actually type in the prescriptions that you yourself are taking. What this tool does is it then takes into account the formularies for all of the Part D plans in your area. Now, these formularies consist of the premium for the plan, the deductible for the plan, and then the copay level amounts for all of the prescriptions that the plan covers. So then what the tool does behind the scenes is it calculates up your total annual estimated cost for each one of the plans that are available in your area, and then lists those plans in order from least to most expensive based on total annual cost. And that's really what you should be basing your decision on anyway, which plan is going to minimize your total annual cost out of pocket. And then from there, you can look at the top 2 or 3 plans to make your choice. So be careful if you're looking at buying a Part D plan. Make sure you're utilizing Medicare.gov's website. And if you need any help on that, I'm more than happy to walk you through how to get to that spot on Medicare's website. So we're almost done here, folks. We're going to be heading to our last section here on enrollment periods. And in regards to enrollment periods, there's a couple different periods that you need to be aware of. And the first one here is called your initial election period, otherwise known as IEP. This is the first time that you can sign up for Medicare A, B, C, and or Part D. Now, as you can see here in the image, it's a 7-month window. And you look at the month of your birthday, okay? This window starts 3 months before the month of your 65th birthday, includes the month of your 65th birthday, and then the 3 months after your 65th birthday, and that's how you get your 7-month window. A real quick example on who should be concerned with this enrollment period is those of you out there turning 65, not collecting Social Security. As we talked about before, if you're turning 65 and you need Medicare benefits, you're not automatically enrolled in Medicare if you're not collecting Social Security benefits. Here's where I told you had to take action, right? So if you have to take action, if that's you, the soonest you can sign up for A and B would be 3 months before your 65th birthday month. But to make sure you're not penalized, you would have to make sure you're signed up within those 3 months after your 65th birthday. If for some reason you dropped the ball and you didn't sign up until after that 3rd month after your birthday, a penalty will begin. You want to make sure you avoid any penalty. So again, that's the 7-month window. That would also go if you were looking at a Part C or a Part D plan. The next enrollment period we're going to talk about is called open enrollment for Medicare supplements. So if you're going to be considering a Medicare supplement, here's what you need to understand. This is an open enrollment period where you can buy any supplemental policy sold here in Wisconsin without underwriting. What does that mean? That means you're guaranteed to get coverage with whatever company you want, regardless of any pre-existing conditions you may have. You cannot be declined. This is huge. This begins on the month you enroll in Part B, and it ends 6 months after. Okay, so this is a 6-month window. So if you start Medicare Part B in September, you get September, October, November, December, January through February, where you're guaranteed to get any supplemental insurance of your choice without pre-existing conditions. You're guaranteed to get coverage. Now here in Wisconsin, if your birthday's in September, Wisconsin allows you 3 months before your birthday month. So that would be June. That's the soonest you could apply for your supplemental benefits so that they're ready on September 1st for you. This 6-month period here is for a couple different reasons. If you tried a supplement on, didn't like it, you can switch again within that 6-month period. Or like I said before, if you dropped the ball and didn't get something right away, you would have 6 months to make sure you get something in place. So be careful here. This happens one time in your lifetime where you're guaranteed to get supplemental coverage. The last enrollment period we're going to talk about here, folks, is called the annual enrollment period, okay, also known as AEP. This is where a lot of confusion comes in. I think there's this perception out there that if people don't like what they have for coverage, they can just switch next year. Well, that's sometimes the case, but not always. So let's clarify this, because I want you again to make an educated decision on your Medicare coverage. So AEP, this runs in the fall of the year. Yes, it runs between October 15th and December 7th. This is the enrollment, this is the period in which you can change your prescription drug plan, your Part D, and or your Medicare Advantage plan. So let's just clarify here what you can do during this time. If you had a Part D plan this year, not in July, not in May, but between October 15th and December 7th, you can switch from one Part D plan to another. Coverage on the new Part D plan, then, as you can see in the illustration, starts on January 1st. So you're committed to your Part D plan for an entire calendar year. You would have to enroll by December 7th in the new plan, and then, like I said, coverage starts on January 1st. What else can you do during this enrollment period time? If you had a Part C plan, you can switch to another Part C plan. Like those Part Ds, you're committed to that Part C plan for the entire calendar year, and by December 7th, you could enroll into the new Part C plan, and coverage on the new plan starts January 1st. Now, what about if you had Medicare A and B with a supplement? Yes, during this window, you can go to a Part C plan if you want to. You couldn't do it before October 15th or after December 7th, but between this window, if you had A and B and supplement for a number of years, this would be the window where you could go pick up a Part C plan. Now, this last part here, folks, here's where the confusion lies. If you had a Part C plan and you wanted to go back to original Medicare A and B, can you do that? The answer is yes. Between October 15th and December 7th, if you had a Part C plan this year, you can go back and get Medicare A and B. However, what are you not guaranteed to get? You're not guaranteed to get the supplemental coverage that you may want. So here's where the misperception comes. People sometimes think that if you don't like what you have, if you don't like a Part C plan you took, you can just go get a supplement next year. That's not true. When were you guaranteed to get the supplement? You were guaranteed to get the supplement, as we just talked about before, within the first 6 months of starting Medicare A and B. It's the only time you're guaranteed. Unless, of course, your Part C plan cancels you, well, then that's a whole different issue. Then you would qualify for something called guaranteed issue rights. If your Advantage plan canceled you, you would get 63 days where you could go get a supplement. But if you voluntarily wanted to leave the Advantage plan, like I just mentioned, you can get your A and B during this window, but you're not guaranteed to get your supplement. Now, there is a caveat here. There's an exception to the rule. If you took an Advantage plan as your first initial option when starting Medicare, and within the first 12 months, you tried it on, you didn't like the Advantage plan, what does Medicare let you do? They will let you go get A and B, and you will be guaranteed to get a supplemental plan as well. But that's only if you took an Advantage plan as your initial coverage option, and within the first 12 months decided to go back to original Medicare. But if you took a Part C plan and after 2 years wanted to go get a supplement, that's when you're not guaranteed to get the supplemental plan. So I hope that clears up the ability to switch plans. What does this ultimately mean? I think what this ultimately means is if you think you may ever want supplemental coverage, when is the best time to get it? The best time to get it is within the first 6 months of starting Medicare Part B. And again, the reason why is that's when you're guaranteed to get your coverage. You're guaranteed to get your supplemental coverage within the first 6 months of starting Medicare. Now, if you started with an Advantage plan, you would have to time it just right to make sure that you can health qualify to get that supplemental plan. I think the moral of the story here is if you think you might want a supplement, make sure you take it when you're guaranteed. That's within the first 6 months of starting Medicare. And although you can switch supplemental plans anytime throughout the year because changing from one supplement to another isn't subject to this window that I just gave you here, after the first 6 months of starting Part B, you're not guaranteed to get a new supplement either. You always have to answer those health questions. So if you're going to go with a supplement initially, because that's when you're guaranteed to get it, I would suggest you get it right the first time as well. So, folks, this is a lot of information. We've covered a lot today. And if your heads are spinning, that's completely normal. Hopefully you took some notes. We are going to be running this webinar again, so if you want to attend the webinar again, you're more than welcome to. But at this point, you basically have two options. At this time, you have the choice of taking this information and mulling it over and thinking about doing things on your own, or your other choice would be getting more help. So you can go at this alone and maybe wonder for years if you're going to make the right decision on your own. Or you get help from me and my team who specialize in this. Our clients choose to work with us because of the confidence they gain through the educational process we lead them through. Now, if you think we can help and decide to go with option 2 and then decide to work with us, here's what you can expect. So if this sounds like you and you want some help with getting the best Medicare insurance coverage that fits you, then I invite you to set up a time to talk with me. Over the next 5 days, I have set aside some time to talk with you and see if I can help. We'll talk for roughly 20 minutes and we'll map out an exact action plan for you to follow so that you can get the best Medicare insurance coverage that fits you. To schedule your free 20-minute phone call with me, write this website down. It's start.grutzfinancial.com/apply. At this website, you'll get a live look at our calendar and get to select the 20-minute time slot that best fits your schedule. I have about 7 appointments available in the next 5 days, so you should take a look at the schedule now and get your time set up. Again, it's start.grutzfinancial.com/apply. At this point, folks, I want to thank you very much for attending today's webinar. Have a great rest of your day.